Okay, this is because he's just been bypassing and he had some blood this morning, and his SATs are fine. They're 95 at the moment. They should be 98 normally, and his blood pressure was 121. So I'm looking at him. You're feeling fine, aren't you, Ben?
I've gone back into AD again now.
Okay, so the first thing I'm going to do is I'm going to measure the catheter to make sure the catheter is in situ, and I'll put a catheter back out. You alright?
Yeah.
Sure?
Yes.
I'm not sure if he's still got stones in there, bladder stones, kidney stones. He's had a bit of both. So we've been obviously I've just massaged the area here and around here. So I've massaged the left kidney where the bladder, where the kidney stones was. And the bladder, I'll just give it a massage. So this is a catheter pack. It is sterile. You can open it by using the corners like this to open it. And what I want out there, so I'm going to tip it upside down without touching it, really. And I want one specific thing right now is a tape, which is here. So what I'm going to do is I'm going to measure. I measured it this morning when we did it, after he had a shower, so it was in situ then. But he's since then gone into AD. Not major AD, but he's still gone into AD.
A little bit, Lauren.
Pardon?
It's only a little bit of AD.
Yeah, you're not major, are you? So
No.
what you need to do is go by the centimetres. So that little bit there on each corner, you need to make sure it's centimetres. You're going to go right into the stoma to obviously measure it. So I'll go right down onto the stoma part, take it up to here, and it should be 20, line at 24, isn't it? Not 28. Yep, that's perfect. So that's in situ. I'm going to actually probably check the balloon, even though it will, if I deflate it, we're going to be messing about. Do you want a bladder wash?
Well, what do you think?
Well, it's your body. You need to tell me how you feel, because I've got a flow. I've actually got a flow back again. So we've got urine output.
Perhaps it's just mini blockages inside.
And what I believe he's had some blood trauma from the catheter change itself. So after you've had that, normally you do get trauma. You do get sediments. There's no sediments coming out of this right now. It's absolutely clear. So that's a good sign.
Yeah, I've stopped feeling it now. It's just
gone again. Feeling AD?
It's gone again now.
Do you want me to check the balloon or not?
Well.
You can put your arms down, darling. What are you doing?
You've just took that off.
Well, there's nothing I can do about that now. Just tell me, what would you like? So this is obviously for carers, for Ben, for the future, for when I'm dead. So at the end of the day, I think
we should do something, because
I
feel like there's something wrong.
Okay, bladder wash first, okay? Because it's been measured and it measures perfect. Sorry if the camera comes out of...
the SATs were fine anyhow.
SATs perfect. What I'm going to do is just put a bit of Instilla gel round, which is the local anaesthetic. So I'm not touching it. It's all non-touch technique. So I'll pop a bit of that in there, just so it doesn't hurt. Well, it doesn't feel anyway, but obviously I don't need him going into major AD, and that is the one thing we're trying to avoid.
I love how you put that.
Rescue meds already here, and he has his opened up the capsule, and here's the box of capsules that we keep, and I keep dates on everything. So that I haven't got a mask on because I haven't had time, because the AD just come on too quickly. Now these are 100 mils, so we don't give Ben 100 mils at all, because he will go more into AD. So you check the bottom for dates. All these dates have all been checked. So where are we with you, Ben? There.
Keep going.
Let's get you there. There you are, my little love. There you are.
I'm there.
And how you feeling now?
Fine.
So let's get your SATs back on.
You want it back on that?
Yeah, we'll just get it on just to make sure that everything's peachy before I start.
Yeah, no,
because what happens with when you do a bladder wash with Ben, he normally goes into full AD or can go in full AD. You've got such little tiny fingers. Put your arm down. So always give a blood pressure reading before you start. So we'll start that off, and I will get my stuff. All my stuff is ready actually on the bed already because I didn't really get much of a choice to obviously get on and do this. So we'll wait for this reading. It's sat to 98, so they're pretty perfect. So there's a segregated area, but I still never can do it. It's a nightmare. And the lighting in here at the moment, I didn't put the lights on properly, but never mind, I can't be touching anything now.
Can you get it open?
Can I help? I can never get these things open. Get a pair of scissors. This is a bit of a faffing around because do you know what? He's been up partly of the night, so it's made him exhausted.
22.
That's perfect.
Good BP.
Absolutely perfect BP. I just hope this doesn't make him worse now, because sometimes this can make them a lot worse, having a bladder wash.
Well, you're only getting rid of whatever's blocking.
He wants me to remove the catheter. I'm not doing that. It's only just been done. I'll cause any more trauma.
No.
They're a right nightmare, look, to get off sometimes. So yeah, you do need to mess about a little bit with these.
Can I remove that now?
Just keep that on, please, because while I'm doing this, because I need to make sure. So always keep your sats on, and always keep your BP going. His BP is lying at 122/93, so that's perfect. So I'm going to get this ready now. And what we'll do is we will bring this across, which is the sterile pack. I obviously have to use Ben's body for this. It's the only way for me to do it. And it's easier for anyone else, to be fair. So what we're going to do is we're going to uncap with dirty hands, uncap this. So your leg bag gets uncapped completely.
You've got a tray.
Move all that sterilised stuff there and use this sterilised. So there's a little sterilised sheet that I'll pop underneath, and no, my gloves are not sterilised right now because I don't need sterilised gloves for this, but I do for this part. So all I'll do, what?
Nothing.
Here, what comes?
Bit of AD, a little bit.
See, why are you having AD all of a sudden? I just don't understand.
Okay, no.
So I do have sterilised wipes here, so you know what, sometimes where I haven't got time to mess about, I'll wipe my glove with a sterilised wipe, and then I'm just going to go straight in with this bladder wash, which is here. And I'm going, I've got a clamp which I will clamp off wherever my clamp's gone. I lose everything at the moment because all we keep doing is catheter. And I've lost my clamp. I can't clamp off then. So no clamping. It's a bit of a messy job, but never mind. And the clamp's not in there, so I need to look for the clamps as soon as this is finished. Otherwise, urine gets everywhere because you can clamp off, and it makes it be a little bit better. So detach your catheter. Sometimes it's really hard to detach these because I'm just going to check, see if there's a flow, which we have got a flow. I don't know whether the camera can pick this flow up, but I'll show you the flow if you can. It's not much of a flow at the moment, but that's because it's in the bag, it's in the urine bag. So are you ready for this? Take a nice breath. So you pop this into the where you would put your bag. Make sure it's on secure. Okay. And he's going to go 1, 2, 3, and I'm going to push. So I know I've got a lovely flow.
Okay.
Release. Let that come into the tray. Use your wipes and pop the wipes into the tray so that then the urine doesn't splatter out. And he'll breathe. Reattach your bag. How's that?
Oh, I feel better now.
Always better. He's always better.
Do you think there was something stopping it?
I don't know, because we've got a warm catheter, which is beautiful. I really do not know on this one.
I do
believe it's because we had a clot this morning. Is your chest all right now?
Yeah.
Go on, cough a sit after that if you want. So I do believe the blood clot has probably had something to do with it. I will get hold of the doctors because this keeps... this has happened twice, is it? Twice?
It's
And
happened a few times.
3
yeah.
catheter changes, and it's like, you know what? Sometimes I've had enough, and today I've had enough, really. So the way to clean up the skin, it's a little tip, is baby wipes. And baby wipes, because it removes the urine from the skin. So what we'll do is we'll remove the catheter pack and get that out of the way, so that there's no urine on Ben at all. And that is what you do for a bladder wash. So what I'll be doing now is I'll just be checking his BP. I deglove. I've already got 100 mils out, so I know that catheter is working.
Yes.
And by looking at Ben's breathing, which is his shoulders, if he rises like that, you know he's got an issue. He's just knocked off.
What have I knocked off?
He's knocked the whole of the meds out, which was rescue meds if I needed them. I'm going to have to go like that and bite them myself to get them in.
It's fine.
But
it's
he's
fine.
absolutely fine. That is a bladder wash. That's how you do Ben's bladder wash.
Is good.
And in all fairness, he's feeling fine.
Did you
I
feel
will
anything?
do that reading.
Did
Pardon?
you feel anything?
There was nothing. When it went in, it didn't have no resistance. So we'll talk about a bit of resistance there. So the flow went absolutely peachy perfect. So I'm going to get him up and I'll pad him up, but I'll also put the night bag in a day bag and I'll put it over the top of the trousers so that I can
do that.
check
Watch the
now in it. And
watch the fluids, love.
yeah.
And that's how you do it.
We'll keep our eye on him. And how are you feeling, my darling?
I feel alright now, actually.
Let me deglove and then get a reading.
Deglove, get a reading, then get me up.
Yep. Let me just do that one glove and that one glove. It's alright, I've got 3 pairs of gloves on. So, what we'll do is we'll do another reading. And hopefully, from this reading, I don't know whether you can see it. Not me. See this. Not me. How'd you turn the camera around? Okay. I don't know how to do it, but, you know, let's get a proper reading, and then hopefully you can watch to make sure we get a good reading there. Heart rate's a little low.
Is it?
Only a little bit. I think personally we're going to get a good reading. You see my face again. I think we're going to get a good reading. I can't tell if this is showing a reading or not. I just want to make sure that we get this in for staff. So it is up high. So it's at 169 over 99. So it is a bit high. And obviously, the rescue meds we haven't got. So I will prepare some and just make sure that that catheter is okay. I'm going to bring you around to show you. Sorry about my face, like, but you know. So we have very good see-through. So this is a telltale sign of still an infection, and I believe he probably needs different antibiotics. I don't know whether the camera can see this. Can you see how translucent it is? It shouldn't be like that, really. It should be a bit yellowy, orangey, you know, colour. And at the catheter site, I will show you if you can, that's just instiller gel down there. And then this is really lovely and warm to touch. So that's another thing to go by, is the warmth all the way down the tubing. Not sure you can see this because obviously I don't know if that's working or not. But as far as I'm concerned, everything is looking okay with Ben. I'm going to get him off and we're going to try now round 2.